Yeah, good day, ladies and gentlemen. Today's topic will be the use of modern functional diagnostic methods in the practical work of a dentist. As you all know, the main task of orthopedic dentistry is to achieve high-quality prosthetic in restoring the integrity of teeth and dentition. One of the conditions for high-quality prosthetic is the uniformity and simultaneous closure of the dentition in the central occlusion and the presence of multiple contacts. In our work, we use the FPD 8010E, which is the Fujifilm pressure distribution mapping system. It provides with a wide range of effective presentation and report function utilizing the FPD 8010E software and a scanner to digitalize prescale outputs to allow the user to produce multifaceted measurements data such as pressure distribution, which we'll use in our work. The goal of our study was to obtain precise occlusiograms, to develop a method of determination of chewing pressure on bridge-like prosthetics using modern technologies.
Sorry, where is your presentation?
Sorry, it doesn't show to you. 1 second. I thought it was shown to you. But I got it on 1 second. Can you see it now?
No.
Well, yes, it was fine, actually.
It was appearing to me.
Oh. So let's try this. Can you see it now?
Yes. I can see it.
Okay, so when do stop? The goal of the study. The goal of the study was to evaluate occlusion and articulation ratios of the dentition series. As I told before, we used the scanner, the pressure measurement film, the calibration sheet, the cover to get a more precise measure, and of course the matrix from the prescale film. There are two types of prescale films. The one-sheet type or mono-sheet type. It contains the color developing material on a polyester base and a fixating material, which, as I said, fixates the color, by which we can determine the exact pressure, which is conducted on a point. And the two-sheet paper, which has, as I said, two sheets. One contains the color developing material, and the second is a fixating material. To evaluate the pressure, we had, as I remember, 3 patients. One of them was patient T, 44 years old. This patient is, according to our study, has an evaluated pressure on the left side of the chewing area and on the right side. As you can see, on the left side, the biggest pressure is 27.61. And on the right side is 33.4. Although on the last models the pressure is 30.5 and the distribution is uniform, as you can see there is a little of under-pressured area in the front, at the front teeth. From this study we can advise that the patient has to correct or replace the old filling material to distribute pressure more evenly. The reason for the rapid destruction of the fillings may be the incorrect distribution of the chewing pressure, as you can see on this slide. Next one is patient G, 46 years old. This patient has a little pressure on the left of 20.3 and on the right 26.1, and 0 due to the missing tooth on the left premolar area. 10.2 on the right. Also, the right and left fangs or canines, call them what you want, are 16.0, as you can see here. In the frontal section on the left is 11.6, and to the right is 16.0. The patient has generalized periodontitis due to the weakness of periodontal tissues. The pressure on the occlusal surfaces is slightly weaker, and the patient is advised to consult with the periodontist. The second patient is patient M, 49-year-old. we have, as you can see on the slide, we have uneven pressure distribution. As you can see on the left molar area pressure is 26.1 and on the right is 11.6 in the molar area, but in the premolar area you can see there is a 30.5 points of pressure. He is recommended to see an orthopedic doctor with further correction of occlusion. As you can see, the conclusions of our work is to significantly improve the effectiveness of prosthetics due to the qualitative determination of the uniformity and correct closure of dentition in the position of central occlusion and the presence of multiple contacts. In the case of unevenness of the contacts, as you have seen before, the underpressured areas, in the combination with other symptoms, determine the cause of pathological factors of periodontitis and periodontitis. To prevent lesions of the temporomandibular joint and to diagnose early stages of their disease. And, if possible, to use it for prosthetics on implants. Thank you for your attention.